I think we begin by making sure that infants are born healthy, into safe families, in safe neighborhoods, with two parents. So I'm starting with the basics of life, not so much the mental health aspects, but ever so many children in the world don't have two parents, don't have a safe home, don't have the nutrition they need. And if you don't have those things, we can't talk about the psychological aspects of life anymore. So begin at the beginning with that. Thereafter, look at the quality of the relationship between the adults. It's unlikely that the infant will be happier than his parents are. So if they have problems, let's help the parents. That will be very, very useful in helping the infant. Support the family, support the parents. Give the mother enough time to be relaxed with this baby, to care for him so that she isn't working every minute. Child could go to daycare, but in countries that have almost universal daycare, mothers often don't know their babies anymore. I don't know that I would want to promote that. I think a couple years for a mother to actually know her baby, or the father if he prefers to be the primary caregiver. But I am not convinced that we have gone the right direction in seeking to have children in daycare so early, so long. I think I'd want them to have two kinds of experiences that the professionals I work with have too little of. I'd want them to have spent a lot of time in the homes of the kinds of families they're going to work with. Not in their offices, not in the centers where they work, but in the homes where the families live. I think too often we create programs for a kind of home that is more orderly, has fewer people, is better educated than the homes that these families live in. I think if we want to meet their needs, we need to spend a lot of time in those homes to feel what it is like to live in the space that they are in, to have the people there who are there. I would want to spend time meeting the extended family. I think my perspective has been very colored by the fact that I did a tremendous amount of home visiting, that I ran neighborhood support centers in the neighborhoods where the people lived. I knew the boyfriends, I knew the fathers, I knew the grandmothers. And it starts to change the way you think about the kinds of changes that people should be making when you try to do it in their flat, with the people they know. Suddenly some of the ideas that you read in your manual, you go, you can't do that there. That isn't what they need. So I think the first thing I would suggest is a lot more time in the living conditions of the people that we are trying to help. Then, I've spent the last 20 to 30 years of my career teaching professionals to observe. They have been taught what to do, but I was really quite shocked at the limited observational skills of most of the professionals that I have worked with. And so now I spend hours and hours teaching them how to view behavior so that they will see what is, as opposed to acting on what they were taught to do. You don't see what people are doing. You don't know when to offer which of your various responses. I think professionals are given a fine array of things to do. Just don't think we teach them well enough to observe when to do it. Both observing, as with video, which you've seen, but also observing with their ears. Hearing what is said differently than I think they ordinarily hear it. I think too often professionals are preparing what they will say as opposed to listening to what the other person has to say. And when I teach something like the adult attachment interview, I am teaching a different kind of interviewing than most professionals know. Generally, they want information so that they can start giving advice. And I want to teach them to hear the story of the person they want to help before they decide what kind of help this person might need. To really hear not only the content of what the person says, but how hard it is to say it, and where the gaps are, and where it makes them almost quiver with the crying that you see in their mouth, or their voice breaks. This is where the information is. And I want professionals to learn how to pull that information out by not cutting off the speaker off. So often, I have to teach professionals to hear the painful part, because they either want to rush in with, "Oh, but it'll be all right, we'll help you, it'll be okay," or they cut the speaker off because they can't face the pain of the real story. Yet these are the people who have said, "We want to go and help." So if I were to summarize it, it's learn to look and listen to get accurate information. I think we already teach them what to do. We don't teach them how to find the times and places to do it. Saludos a todos.